Good afternoon. This is your County Executive Ed Day. I hope all is well with you. We're doing a Facebook Live today in keeping with my promise that every once in a while there needs to be a focus on some of the issues going on here in Rockland County. Last Friday afternoon, the governor issued a state of emergency order for the state of New York as it related to polio, and that was followed up today by the Centers for Disease Control, the CDC, who offered up some more direction and information on the polio issue that we've been talking about. I just want to put things in a balance because the state of emergencies is not an oh my gosh moment in all situations, and this is certainly one of them. The state of emergencies will do many things. In this particular case, it will expand who can administer polio vaccines. So we can include EMS workers, for example, midwives under supervision, and pharmacists. I do have the EO here, and I'm going to hit a couple of high points. They allowed certified emergency medical technicians and paramedics and advanced EMS providers to administer vaccinations. Midwives, as I said earlier, can administer under supervision. They allow pharmacists to administer vaccinations against polio, the polio virus. And very important because we have to keep a good handle on what's going on. The polio virus vaccinations for any individual, child, or adult now must be reported to the state of New York within 72 hours of administration of a polio virus vaccination. All these things will give the state and naturally the CDC and here locally and other health departments some sense of what they're up against as it relates to and what the directions are as it relates to the vaccination process, which, as I've said many times, and we're going to continue to say it, that is our ticket out of this is vaccinations, and we're going to go into that a little bit later on. What prompted this move apparently was in the wastewaters in Nassau County, there was polio virus detected there. Now you'll remember that here in Rockland, and it was prior to having the first person who was found to have the polio virus, an active case of it, we had made a decision here to take a look at the wastewaters because there's reports from England that their wastewaters was showing up with polio virus in it. So we started doing those samples, and sure enough, a couple of weeks later, a first and only subject case became infected. There's no additional polio cases that have been found as of yet, and this action really helps the state expand vaccination efforts and surveillance, as we had mentioned earlier. Improving vaccination coverage is the key to preventing additional cases of paralytic polio in the United States. And just so we all understand, there's a lot of conversation trying to compare this to the measles epidemic here that is geographically based. There are certain areas that are causing this. Let me be very clear, and this is the fact of it, not what you may read in other places. As a matter of fact, a single paralytic strain that caused the case in a county resident originated overseas from an unknown individual who received the oral polio vaccine, or OPV, which has not been administered in the U.S. since 2000. So this the person who did get infected here in Rockland did not go travel overseas. So what happened here is the oral polio vaccine was being used a lot. I got what I call the good stuff. I got the original vaccine back in around 1956, I believe, the Salk vaccine. My two younger sisters ended up getting the oral polio vaccine, which was very effective. But they used a live virus for the oral polio vaccine, where there is no live virus in the shot. What happened is they found that with the oral vaccine, there are rare cases where it will revert and mutate, and you could become contagious. The U.S. has not been using this vaccine since 2000. It is used in other countries because it's easier to administer. So what the health department and the CDC determined was the person here who caught polio was number one, and most importantly, that person was not vaccinated. If that person was vaccinated, there would not have been an issue. But that unvaccinated person crossed paths with an unknown person who had a reverted or a mutated virus from that oral vaccine. And again, obviously, the person probably was from overseas because it's been so many years they've done it here, not for 22 years. And again, the exchange, it's not something that typically is very easy to catch, like measles. That contact with measles was 9 times out of 10 you get infected. Polio is typically a fecal to oral transmission, where hygiene is not being practiced. Your hands are not clean after you go to the bathroom. You touch a handle, somebody else touches a handle, maybe touches their face. And also mouth to mouth, obviously, could also transmit. The virus will harbor itself in the intestines, which is why wastewater surveillance is very, very helpful. Unfortunately, we cannot fine-tune the locations here in Rockland. We just have the wastewater that does have it. Now, as far as, again, what occurred here, as I said, this subject case did not travel overseas, number one. That person was a resident of Rockland County. And the fact of the matter is, we also had the New York City Department of Health was part of the initial investigation back in the spring when this first came to light, for obvious reasons. There was a travel to New York City. So nobody knows where this person got the virus from. They just know the strain came from overseas, and it was linked to strains in wastewater samples that were found in the United Kingdom, London, and Israel, as far back as February. This is an international phenomenon. There's no other way of putting it, and that is in origin and in scope. And thankfully, we have not had another case so far of active polio. But just so people understand the issue with polio and why it's so difficult to track, originally people were saying, why don't you do tracing, contact tracing? I said, because nobody knows. Most people who have this are asymptomatic. 74% of the people who have polio virus within them have absolutely no symptoms. 25% have mild symptoms that could range to make you think you have the flu or a cold or a fever, COVID possibly. That's the type of symptoms that you would have, and that's only 25%. 1% of the people who contract the virus have potential for significant impact that could include paralysis, either of a limb or a larger paralysis. It could attack your lungs and your muscles and your breathing muscles, and it could kill you. That's what we're dealing with. So, we want people to understand what we're up against. There is no way of projecting or identifying people, and it is not geographically based. And that's another thing we want to get to people. There's no way you're going to know where any issues lie, like with the measles, for example. We did have more information on that. The CDC did, as I mentioned earlier, today released another report that I'm going to actually go over real quick. It released that the United States now joins 30 other countries where the vaccine-derived strains have been identified. So this one case that we have here, where the identified strain is from an oral polio vaccine, is now part of a case of 30 other countries in the world. We have the general media release from the CDC, and I want to cover it. The virus, some of the highlighted versions I want to get across. The virus's genetic sequences from the patient from Rockland County and wastewater specimens collected in New York have been linked to wastewater samples in London, the UK, and Israel. It indicates community transmission. The virus sequences from the patient from the 3 wastewater specimens have enough genetic changes to meet the definition of the vaccine-derived polio virus. The United States now is one of those 30 countries. And the focus right here, as Dr. Romero, director of the CDC's National Center for Immunizations, we cannot emphasize enough that polio is a dangerous disease for which is no cure. However, the one cure that we have for polio is vaccinations, and CDC strongly recommends, well, we here in Rockland have been recommending to everyone to make sure that you are vaccinated. And we're going to get into the results of our effort in a few minutes. In accordance with the CDC, I'm going to give some information as it relates to what the recommendations are, both for young children and for older people, and also people who have gotten the shot maybe many years ago. All children should get 4 doses of the polio vaccine. The first dose is supposed to be given at 6 weeks through 2 months of age. So obviously, we cannot monitor that very easily because these children are preschool. And I've said before, this is the concern we have here, that preschool children are the ones who are going to be most affected should they get sick. Then we need 1 more dose given at 4 months of age, 6 through 18 months of age, and 4 through 6 years of age. And pretty much almost all these dosages are preschool situations. So there's a series of 4 doses that are given out. And again, this is something that has been done for many, many years. People starting the polio immunization series after 4 years of age who are unvaccinated and are unsure if they've been immunized should receive a total of 3 doses. Adults who have had only 1 or 2 doses of the polio vaccine in the past should get the remaining 1 or 2 doses. It does not matter how long it has been since you had the earlier doses. Now, these are some of the things that we were resistant to giving out as elected officials, for example, because we don't know your particular situation. Your doctor, your medical professionals do, so we always directed you back to the doctor. But now the CDC is comfortable enough to be giving direction out that we can share with everybody. In addition, if you're as an adult, if you live or work in an area where polio virus has been detected, we have a number of counties here in New York State, obviously, including New York City and Nassau County, Rockland, Orange, Sullivan County. And if you don't believe you are vaccinated, you should get vaccinated. Individuals who will or might have had close contact with a person known to be suspected to be infected with polio virus and such person's household members or other close contacts. Obviously, that is a difficult situation because of the fact that most of these cases are asymptomatic. So it's great recommendation, but as a practical matter, I certainly understand it's very difficult to know this. Healthcare providers working in an area with polio virus have been detected, who might handle specimens in particular that might contain the polio virus, or treat patients in urgent care, emergency departments, neurology, virology, laboratory workers. Folks like that should consider getting the booster. If you are an your occupation includes handling of wastewater, you should consider that booster too. For obvious reasons, the germ will take root within your intestines, and that's where it will come out in the wastewaters of the area that you live in. And if you're unsure, contact your health provider or a health department. You can certainly do that. Yes, by all means. Oh, I forgot something. I made it very clear to my staff that we're going to have certain people here with us today, off camera, and I totally forgot about it by starting off. So we have us today off camera. I have John Lyon, who is my chief of staff. He's working very closely with the health department on this matter, and he really is a wealth of information. And Beth Cefalu, who is my communications director, she's the one running the show here right now. So John just waved at me because I told both of them, if something comes up that I missed, please bring it to our attention. So John?
Sure, just to chime in real quickly. Hello, everyone. The vaccine which is given here, which is what we've been talking about so far, it's the inactivated polio vaccine. This has been administered in the U.S. since the year 2000. Right. It's safe, effective. It will not cause polio. It protects between 99 and 100% of people who get all the recommended doses. So it's very effective. It's one of the most effective vaccines that have ever been created. And we are giving that vaccine at our health department every Monday or Wednesday. You can go on our website to make an appointment, or you can call our county department of health at 845-238-1956. That's 845-238-1956.
Thank you, John. Appreciate that. Yeah, and again, right now we can go into some of the things that we have done so far. We've been utilizing, as many may recall, we had laid out an ability to reach the many community groups from our health department, our health commission, Dr. Rupert. came to me with an idea when I first became county executive about getting the delivery of medical provisions out to the communities as opposed to having people come to Pomona to get that kind of work. And she developed a great network of religious, of community groups across the county, and she used that to be in a very effective manner when we dealt with the measles issue as far as getting people their MMR shots. This is very similar scenario right now. So these are the things that our health commissioner brought forth that contribute to us in Rockland County, twice being named the healthiest county in the state of New York, despite all the challenges that we have seen medically over the last few years. So our focus right now has been on our young ones, our little ones, for the obvious reason that they're the most vulnerable. And since we have no way of knowing by looking at someone if they possibly are infected, everybody could be harboring that virus, and as long as you're vaccinated or others are vaccinated, you're going to be fine. It will not take root. I've likened the matter of polio. When they said the wastewaters, and that's where they're finding it, it brought back a military perspective where you're being attacked. You're being attacked by ships coming in, and they're landing on the beach. You don't want to allow polio to get a foothold in this county or in this country, and that's why we have the CDC involved now. They recognize that while the first case did come to a Rockland resident, it could have been in New York City, the infection. We have no idea where this person contracted this, but now 30 countries are going through this right now. So this is an international issue, as I mentioned earlier. But here in Rockland, we are focusing our efforts on the one thing that will stop this cold, and that is everybody get vaccinated, and particularly those little ones, because we don't want to see a situation, and those who are in my age group will remember iron lungs and what damage that could have been done to young people back in the 1940s and 50s, for example. So we want to avoid that. But right now, and again, there is a lag on these numbers because it takes 2 weeks for the numbers to get caught up. And now, as I mentioned in the emergency order that was issued by the governor, there's a mandate now that they have to report the immunizations. But again, it takes a couple of weeks to get that done. So right now, from birth to 4 years of age, let me get the total. The total number is 5,064 polio doses have been administered to Rockland residents since July 21st. That's a significant uptick. Those who have been following this know that. 77.2% of those immunizations are birth to 4 years of age. That goes back to when we first spoke about what that schedule that schedule has to look like to get a child fully immunized. 77% or so are the children. 5 to 18 is just under 14%. 19 to 64 is about 5%, and 65 and up is about 4%. We also are, again, we're not only just utilizing the existing connections we have in the community, with community groups. We have our community affairs personnel fully involved and fully engaged in this, as is our health department. We also have been using flyers. We've been hiring organizations who this is what their skill set is. So what we have now is, I'm going to hold up this is one of the flyers that is being sent out. I think how many did we send out of these?
Oh, thousands.
Thousands. This is just one. I don't know if it's
a little closer.
Okay, this is one. And you can see, you can just get an idea of what the flyer looks like. And we also have other flyers. I don't know which one this one is. This is what?
Spanish version.
Spanish version of it. Yiddish version of it. And this is Creole. It should be Creole. But these flyers have been going out. We're posting them all over the place, obviously on county property, and we're going to other people who can get those flyers up and get them distributed, including newsletters. So we're doing that. And again, that's our focus right now. It's the focus of the CDC is to make sure vaccinations are up to speed. It's a focus of the State Department of Health to make sure the vaccinations are up to speed. It is the focus of the Rockland County Health Department to do the same thing. And again, I just want to just make one thing perfectly clear, which John did touch upon. This vaccine is 65 years in process. I got this back, I said, in the mid-50s. It's safe. It works. It's pretty much absolute to protect you against polio. And again, think of people around you, especially if you have children around you and you are not vaccinated. Somehow, some way, you were not vaccinated. You may have come here, later in life to the United States where you didn't have a mandate to get vaccinated. You could be harboring this germ, and not for just your own health, you want to make sure that you don't infect a child. So we urge you to get vaccinated because that is the one thing that will protect you in almost an absolute manner. Also, we're going to translate this video into YouTube, and I'll be sending it out on my email blast. The email blast comes out once a week from me, and we'll update you on things that are going on in Rockland County. If you want to sign up for that, you just go to my website at edday.us. That's edday.us. On the right-hand side of the homepage, there's a slot where you can put your email address on there, and you'll get weekly updates. Typically Monday morning, we get an update out to everybody. Right now, there are about 15,000 people who are on that blast. People like it. It's not political. Basically, it brings up a lot of very important things that are going on. And should we make the other announcement when we have everybody? The water, yeah.
Oh,
Yeah.
Okay.
There was a mention of it.
I'm trying to think, do I have I don't know if I have a press release. Well, anyway. Well, we have good news. I don't have all the specifics with me, but it'll be coming out this afternoon and for tomorrow morning. The water emergency that was declared, we had to declare because of the drought conditions we're having here in Rockland County. We've been working very diligently and monitoring this, working with our obviously with Viola. Our health department has been very actively engaged in that. It has been, obviously, it's something we did not want to do, but the fact of the matter is I don't want Rockland County being known as a drought county. It's just not a good look. I want Rockland County to be welcoming, and I want to make sure that people want to invest in this county, and having a drought is not a good thing. But we have to look at the larger issue, so we had to declare the drought emergency. Effective immediately after reviewing all the circumstances, including things such as we don't want compromised hygiene, especially given what we're dealing with right now, because washing your hands is very important. We are lifting the restrictions immediately. I want to acknowledge the people of Rockland County, and I'll just repeat something that initially when we did the drought emergency, we saw a reduction of 11.4% in water usage. It is now at 15%. So you've reduced the usage of water here in Rockland by 15%, and this is it was a very difficult time, a tough time to measure because we are going into the fall, which typically means that less water is being used, but unfortunately our falls here in Rockland County have been relatively warm, so we can't always count on that. But after we all sat down together, looked at all the possibilities and looked at all all the benchmarks that we had to look at, the triggers we had to look at, I felt it was better that we do that. Also, the concern we had also was the fact that there would be a potential for an increase in the rate if you get over a certain amount. We explained that was unlikely. We want to make sure nobody is being charged additional money when it's not necessary. It's tough right now with prices going up. So we're just trying to relieve a little bit more of that burden off the people of Rockland County and ensure that your water rates do not go up. So since the rate increase only happened when with 30 days in a drought and only after a certain amount of water being used, we have not been in a drought for 30 days, which it has been lifted, rescinded, and in addition, obviously, then the other part doesn't apply. So there will not be any increase in water rates due to the drought that we have. That is off the table right now. So I just want to share that with everybody. Hopefully that it relaxes some people a bit. But again, please continue what you're doing with water limitations. You're doing a great job. You're a partner in this. I've said this many times. People of Rockland, when they're asked they step to the plate and get things done. We had a previous governor who liked to push people around. Here in Rockland County, we respect all of you, and we respect what you are all about and what you do to make things happen in a good and positive way here in Rockland. And again, I thank you all for your cooperation. Do we have any questions or anything else? Or?
The only question was about the water restrictions. So
okay.
You covered.
There we go. Okay. Well, anyway, again, this is your County Executive Ed Day. We will go back to, again, doing updates as necessary. In this particular case, with the weighing in of the governor's office and the Fed's CDC, we felt it was important to get back to you, and also give us a chance to speak about what this is not, and the fact that it is completely controllable. There is no reason why polio should get a foothold in our county or in our country. So, again, I urge everybody to get vaccinated if you're not vaccinated, and please make sure the little ones get on their schedule for the vaccinations. And with that, I'm going to sign off for the afternoon. Have yourself a wonderful evening, and we'll talk soon.